So room 422, Mr. Smith is a 63-year-old male admitted today through the ER with COPD and community-acquired pneumonia. He's on observation, full code. He has no primary care physician. He came in with a 2-day history of fever and chills, cough, worsening shortness of breath, fever and diffuse wheezing and all lung fills per the ER nurse. He had a complaint also in the ER that he wasn't able to void, so they placed a Foley for retention. He had a chest x-ray done in the ER showing a left lower lobe infiltrate. They drew cultures, they're pending. White count was elevated. This morning his blood pressure was systolically in the 130s, heart rate sustaining like high 90s, respiratory rates up 23. He does have like a low grade temp 99.5. He's on 4 liters statting 92%, no complaint of chest pain. Tele was unremarkable. He is, he has some tachypnea this morning, but not using any accessory muscles. He says he feels better today versus last night. He does have some scattered wheezes, the left lower base had some crackles, his good pulses. He has a good IV, working IV in the left AC that was placed today, and the Foley has good urine output. He doesn't have any pain. He said he just feels uncomfortable when he's coughing. He got Rocephin and Zithrote both in the ED, and they're continuing these antibiotics. He's going to get them this morning. And he also got some NEBS treatments, and he started an oral prednisone for the COPD. He does have a long history of smoking in the past. He said he quote unquote quit a week ago. He said he's been in the hospital 2 other times for trouble of breathing, most likely COPD exacerbation. Like I said, he has no primary care, so he just goes to urgent care for any problems. No high risks for TB. He does qualify for pneumonia and flu vaccines, so he'll get those today. And he's on Lovenox for DVT prophylaxis. This gentleman's going to be a high risk for COPD exacerbation for readmission. But I was wondering if we can remove the Foley today, and like I said, I'll go ahead and give him the vaccines.
Yeah, I think that's a great idea. Let's get the Foley out and just watch his output, make sure he doesn't have any other retention. I think we'll continue the current antibiotic therapy that you mentioned, and then we'll see if there's any culture results, so watch if there's any positive cultures. Let's just watch his COPD exacerbation. It sounds like he's had several episodes in the past, and we'll keep giving him the steroids and RT treatments. Just kind of watch his respiratory status, make sure he's not worsening. If he's stable through today, we maybe could move him up to the 4th floor, and then we definitely need to find him a PCP for follow-up.
Okay, so I'll call the PCC to come and see him.
All right, great. Thanks a lot, Amy.
Thank you.